Hello, I'm Dr. Pramod Bhor, Director of Orthopedics and Joint Replacement Surgeon at Fortis Hospital, Vashi. So today we are not going to talk about joint replacement. We are going to talk about joint preservation. Joint preservation does not mean only surgeries. Joint preservation does mean conservative management and surgical management. So what is joint preservation? Joint preservation means trying to avoid knee replacement, trying to avoid replacement, where we are trying to save your joint. So this is basically done for an elderly patient who has knee pain, who has osteoarthritis. Osteoarthritis is basically wear and tear of the joint. And in those cases, we have to do some amount, or we have to take measures to avoid it to increase. So we try to slow down the osteoarthritis or aging process of the joint in joint preservation. So as I said, it is either conservative or surgical. So let us talk about conservative means of treatment. Conservative means it starts from medicines. So there are a few medicines which are supposed to be chondroprotective or cartilage regenerating medicines, like chondroitin sulfate, collagen, glucosamine, diacetyl. There are quite a few medicines in those. So these medicines, when taken, they sometimes reduce or slow down the process of cartilage degeneration and slow down the process of osteoarthritis. When that happens, we have to strengthen the muscles. So exercise is the key. Physiotherapy, strengthening the knee muscles is important. Correcting the footwear, using a bit of orthosis like a kneecap or a hinge knee brace is also important way to preserve or to reduce the joint degeneration. So accordingly, we have to understand that we are doing what we are trying to delay is a severe osteoarthritis. Joint preservation is basically done in mild to moderate osteoarthritis. Conservative but a bit invasive procedure is injections in the joint. Injections in the joint, there are various injections available. So normally we try to give either a protein-rich plasma, that is a protein-rich plasma, which helps to regenerate the cartilage. It helps to helps in the healing process. So protein-rich plasma is helpful for patients who have early osteoarthritis or moderate osteoarthritis. Sometimes even give visco supplementation. Visco is basically hyaluronic acid is injected in the joint. It is basically just replacing the fluid in the joint with this viscous fluid so that there is smooth movement in the joint. So there are different indications when we give a PRP, when we give visco supplementation, depending upon the need of the patient. The clinician has to evaluate and accordingly decide. After the conservative management, we have to frankly think about surgical means. So surgically, there are two procedures which are done majorly for joint preservation. One is an arthroscopic surgery, is a keyhole surgery where we clear the joint in the painful knee and we clean whatever torn meniscus or cartilage is there, and so that the joint has a free smooth movement and there is not much wear and tear. So the progression of osteoarthritis decreases. Similarly, in patients who have varus or who have bone knees, we do an osteotomy of the tibia, that is the lower bone, and it corrects the deformity. When the deformity is corrected, the weight-bearing axis changes, and normally when the weight-bearing axis changes, the patient is able to walk more properly and the progression of osteoarthritis is slower. So these are the two main surgeries which are basically for joint preservation. Our joint is not touched. Going to a bit of partial joint replacement is basically done when we have medial or lateral compartment osteoarthritis, a single compartment osteoarthritis. That time we do a partial replacement so that we do not have to replace the other half of the joint. It gives better movements, faster recovery. So that is on the borderline, I would say, joint preservation and joint replacement. So partial knee replacement also can be done. So depending upon the patient, depending upon the pain of the patient, we can decide what type of joint preservation is needed. It is very important that we should be aware that we can definitely prevent a replacement if we are taking care of our joints at an earlier age. It is important for the patient to understand, yes, we have to heed to our pain and go and consult an orthopedic surgeon if you are having early knee osteoarthritis. Thank you.